Yes, doctors went on strike for 13 months when Peter Obi was the governor of Anambra State. I was in school as a student nurse when Peter Obi was the governor. And the question you should ask yourself is, why did they go on strike? And I'm here to explain that to you, why they went on strike, what happened. In 2009, during the time of Umaru Musa Yar'Adua, the federal government introduced a salary structure called COMMES, Consolidated Medical Salary Structure. And COMMES. This for doctors and dental practitioners, and this for nurses and other healthcare professionals. Now, this salary structure was introduced by Federal Public Service Salary Structure, not the state government. The federal government, as of that time, said that the states were not compelled to automatically implement these salary structures fully, that they should do the implementation based on their capacities and resources at hand. For Anambra State, Peter Obi said that he was going to implement 60%, meaning he would increase their salaries by 60%. The Anambra State doctors refused. He pleaded, they refused, that Peter Obi was going to implement 100% increase. Peter Obi told them that the healthcare system in Anambra State as of that time was in shambles. The health sector was in shambles, and the education was at its lowest as of that time. That he was not going to, implement their salary by 100%. Rather, he would do 60. They refused and went on strike. It was that time that Peter Obi now focused fully on mission-owned hospitals, schools of nursing, schools of midwifery, dental, technology, and hospitals. He funded them, refurbished, reconstructed. He did everything possible within his, political and government power. And it was that time that all the schools of nursing and all the schools of midwifery in Anambra State regained their accreditation. And before he left office, more than 12 health institutions, including 2 hospitals, gained accreditation. It was that time. The reason why he made a statement yesterday that despite the fact that they were on strike for 13 months, there was no mass casualty in Anambra State. Do you know why? Because the mission-owned hospitals were functioning, and schools of nursing, schools of midwifery, health sciences, so many schools owned by the mission were functioning. So their absence wasn't felt so much. So when they realized that the state was moving without them, they came back from that strike. Now, here is the catch. They still came back from the strike, and that's the reason why they went on strike was still not implemented. They came back and agreed to what Peter Obi said, 60%. It's okay to talk on social media, but at least try to browse, try to reason, try to know why something happened. They came back. That strike was their own strike, their own need. Lagos State, as of that time, I think implemented 75%. No state, as of that time, implemented 100% of that salary structure. Because it wasn't a state structure. That was Federal Public Service Salary Structure, not the state. But he agreed, as small as Anambra State was then, he said, I was going to implement 60%. They refused and went on strike for 13 months. The health institutions was moving without them. That was why he made that statement. That means there was a concern, right? Another reason why they went on strike, that Peter Obi said all the money that he was spending, in health sectors, the results were not corresponding. Ambulances were missing. He bought ambulance and they all missed. So some of them were missing and they couldn't account for it. So that attitude also influenced his decision that, according to him, the healthcare system was in shambles, right? He could not pay 100% salary increment, right? why the sector where they are going to work was in shambles. So they needed to fix the healthcare sectors so that the salary can make meaning. Do you understand it now? So it's okay to talk on social media, but try to know why things happened and what is happening. Don't just jump and you just want to talk.